Hello and welcome to Nurse Amy back on your screen. Thank you so much for coming. And this topic right here, this one here, it's very dear to me. I mean, all of my topics are. This one I'm going to be speaking directly to scrub lifers like me, those of us who wear scrubs, be you a CNA, a nurse, LPN, LVN, RNs, nurse practitioners, we're all nurses, doctors, people in the medical field. We all get burnt out. And that is so true. If you are like me, who's been doing this for many years, you get burnt out. And if you're like me, you're not only burnt out, but you actually bear like an emblem or badge of honor of chronic pain, okay, which I do have, and I'm managing it thanks to my sweet husband, because we eventually got an inversion table, which has been helping me. So thank you, sweetheart. I have to acknowledge that and give him credit for that, because my inversion table has actually helped me with my chronic pain. So for those of you who are dealing with lower back and sciatica, try an inversion table. I might just put my own, link it down below. I don't know, I might do that. And then just, again, you don't have to buy the type of mine. I'm not trying to sell you anything. I'm just trying to share with you what has worked for me. So, and that has worked for me. What else do I do? Believe it or not, I use my, I know I'm kind of getting off track, so maybe I'll, but I just want to quickly put this in. The gait belt, I use that around my hips. If you want me to talk more about my chronic pain and how I'm dealing with it, please let me know, put in the comments below, and we will do so. So why am I doing this topic today? It's part of my, I'm still going to make it part of my Nurse Amy's Tips for Business 101. And the thing is, I think Amazon is here dropping something off because I have I'm having a lot of things been delivered, because again, I'm starting my business, so that's why I'm talking to you guys. You have to have a way to channel your energy. Okay, we all are burnt out. I don't care if you're a private practice doctor, personal care provider. I don't care if you're an ER doctor. I don't care if you're an ER nurse. As long as you work in this healthcare field. Now, for those of you who don't know this, if you are in healthcare, okay, in the medical field, again, research has shown that a lot of people in healthcare are substance abusers. Now, I don't abuse substance. I don't take my patients' drugs. I don't even take my own drugs. Okay, here I am trying to tell you guys how I am managing my chronic pain without medication. I'm just not a big, that's just me. I'm not saying it's wrong to take medication. Please, please, please. If you are in my class, if you take any of my classes, one thing I tell you is please, give people the medication that has been prescribed for them. If you're not in my shoes, do not tell me how to walk. Pain is what the patient says the pain is. Okay? If the patient is laughing, kiki ka ka ka, and you ask them what's your pain level, and they say it is 100. It is 100. Okay? It's just that, again, you see, I'm getting off topic again. Because all these things, I'm so passionate about them. But because I deal with pain, I can be watching Netflix. I love my Netflix. It doesn't mean I'm not in excruciating pain, but that's what helps me manage pain. So if I tell you my pain is 100, that's what it is. A lot of nurses and doctors, because of frustration, so I'm actually going to tie to this topic, because you're frustrated, because you're burnt out, because you're overworked and you're short-staffed. So you do take out your frustration on your patients. So when they tell you their pain level is 100, and they're laughing and watching Netflix because you're frustrated, and you're angry, and you're bitter, you don't believe them, and so you withhold the pain medication. Please don't. That's just evil. Don't do that. Do not label everyone as drug seeking. You need to stop. Nurses do it. Doctors do it. Doctors, I do know you work within some parameters, so you're being careful not to just prescribe narcotics. But then again, there's a reason for all that. Some of you abuse it. Those, and when I say doctor, is an umbrella for all those that can prescribe. Anyway, you need a side hustle. That's what this topic is. So for you're burnt out, help, I'm burnt out. What can I do? I get this a lot. Where can I work? There's so many places you can work. Everybody cannot and should not be working in the nursing home or in the hospital. You can work in a doctor's office, is not as rigorous. Okay. However, if you work with a doctor that's become reliant on you, well, yes, you're going to be having long hours because you're the one who opens the office and you close the office, and you're going to be holding the doctor's hand and babying the doctor and his patients. So yes, you're probably going to be overworked. However, with the doctor's office is not as rigorous as work in the hospital. Now, some of you like that. That's fine. However, the essence of this topic is just to say, hey, pause. Press pause. How can you channel your energy so you're not lashing out at your colleagues, so you're not being mean? How can you channel your energy so you're not eating your young, new ones coming up? Nurses eat their young. That is so true. Take it or leave it. I've been in this 20 plus years. I know nurses eat their young. Nurses bully. There's a bullying culture in healthcare, period. So my thing is, how can you get away from that? Because the reason why sad people make other people sad, hurt people, bully people. So you've been bullied, you've been hurt, and you've been made sad. So how can you channel that anger in you into a positive? Get a side hustle, get something that makes you happy, and do it. A CNA student of mine, she was my CNA, she was a student, and now she's in nursing school, and she'll be done this, oh my God, she'll be done this summer. Oh yeah. Oh wow, yeah. Interesting how time flies. And she's always loved giving massages. And it's so funny because she had gone on to, did she go where she wants to go? I can't remember now what the story is. School of masseuse. I don't know what it's called. Okay. If you get the name before I do, I might put it the right name. But she loves to give massage, and she's pretty good. She's very, and I told her that's something patients will love. Offer. She's like, I'm always offering massages. People really love it, and I'm like, well, turn that into a business. It's a side hustle. Turn into a business, a relaxing parlor or parlor. I don't know how you want to call it. Okay, so find something that you like to do. You got to channel that energy. There's a lot of anger. There's a lot of frustration. There's a lot of bitterness in the healthcare industry. And that's just what it is. And it stems from the ubiquitous reasons. You have bullying. You have short staff. You have policies that just, make you helpless, A lot of us went into healthcare wanting to help people, and you find you spend 80 or 90% of your time, maybe 95% of your time, just documenting, covering your butt. And then you now have to leave with guilt because there's so many things that happen and that are wrong on your shift, and you got to pick your battles. Now, for those of you who are like, oh no, I don't feel that way. Okay, so maybe you're the unicorn. You don't. That's fine. Good for you. Hey, but for the rest of us that are normal, it's just the way it is. Okay. What is it that makes you happy? You got to find a way. I, for one, my chronic pain actually is staring me off of working on the floor doing direct care. But I'm still providing service by my aesthetics. I'm going into aesthetics, and I'm still providing service, and I enjoy that. I love it. And it kind of marries healthcare with my background, which is creativity type thing, you know, filmmaking, writing, and that kind of good stuff. So I love to lash. When I lash, I love to see how it changes someone's face. I really like that. Believe it or not, it's a lot of work, you know, being a lash artist is a freaking long work. However, it's also very therapeutic for me. I don't know if there are any one of you there. Are there any one of you listening to me who has a side hustle? Could you put it down and let's just talk about it? I'm actually have people on my channel come talk about this stuff, you know. But you got to find a way to vent. Maybe you should journal. Maybe you can turn into a book or a movie one day. Take up a hobby. You got to find something that you do. My biggest thing is you have to have a different stream of income. Turn into an income. Okay. I hope you got value for this, and I'll see you in the next video.